Welcome on the AM News. Now, the Social Security and National Insurance Trust has increased benefits to pensioners by 10%. The amount will affect the lives of 225,000 active pensioners. Speaking at its 2022 indexation, the chief actuarialist of SNIT, that is Joe Poku, disclosed that the lowest earning pensioners would receive 332.48 Ghana cedis. The review was done in consultation with the National Pensions Regulatory Authority, equal to or above the targeted inflation rate for 2022.
Who were receiving 300 cedis will now be getting 332 cedis, 48 pesos for this year. Now, for the highest pensioner in 2021, who was receiving 129,979 cedis, not 51 pesos every month. Let me say that, that's every month, that's what the SNIT pension scheme pays to somebody on the pension payroll. Now for this year, this person is going to receive 142,564 cedis, 97 pesos every month. The scheme is paying somebody this amount every month.
Well, the Director General of SNIT, Dr. John Ofori Tenkrang, says SNIT remains committed to paying all legitimate benefits accurately and timelessly.
We are committed to continue to pay pensions accurately, continuously, and promptly to all those who qualify to receive the SNIT pension. Just so that you know, up until November 2021, which is the 11 calendar months just before we went to spend Christmas, we had paid about 3.3 billion Ghana cedis, 3.3 billion Ghana cedis to pensioners in various forms of pension and associated benefits. And that works out to be about 300 million Ghana cedis a month. 300 million Ghana cedis a month. And I know when we do these things, this is a public interest, so there are even people watching us on the internet, people abroad. 300 million Ghana cedis a month is approximately, call it $50 million a month. 50 million US dollars a month that we pay out. So it's a substantial sum of money that we administer, and we are committed to make sure that we do so transparently and diligently.
On to our next story. And police officers saddled with medical bills and a difficult life as a result of injuries suffered in the line of duty will now access financial help from a 1.6 million Ghana cedi medical emergency fund unveiled by President Akufo-Addo. The fund is part of 3 major projects to boost healthcare delivery for men in the service.
I commend the police administration and the management of the police hospital for constructing this new OPD, which will help decongest the existing facility, which hitherto was responsible for seeing to patients with emergency cases as well as to regular OPD patients. This new OPD, which cost a modest sum of 180,000 cedis, will be dedicated to emergency cases only, in line with best practices. It will ensure a clear line of separation between emergency cases and routine OPD visits, thereby improving the quality of service delivery at the hospital. I'm particularly excited about the establishment of the Virtual Medical Center, the second project I'm commissioning today at this hospital. As most of you may know, since I assumed office some 5 years ago, one of the obvious successes chalked by government has been the execution of the impressive agenda to digitize fully all aspects of our national life. Constructed at an equally modest sum of 50,000 cedis, the Virtual Medical Center, which is an end-to-end video hospital management system, will allow patients no matter where they are located in the country, to undertake virtual consultation with healthcare professionals at this hospital. Police personnel, irrespective of their location, can now access healthcare services from the hospital anywhere in the country at any time. Officers of the service are guaranteed a protected platform for seamless consultations with the doctor. Beginning with virtual OPD attendance, through diagnoses, laboratory referrals, prescription of drugs, and subsequent reviews, all of these medical processes can be done without one having to travel from his or her station.
Well, the Inspector General of Police, Dr. George Ekovo-Dampare, indicates how crucial the fund is, especially to those currently reeling from financial difficulties.
To your commitment towards the provision of logistics for the service and also ensuring the welfare and the well-being of the personnel of the service. Indeed, history will be very kind to you when tomorrow comes. More importantly, Mr. President, of the 3 projects that you are here to commission for us, the first one is to do with the new outpatient department, which in the past was part of the emergency department, making it difficult for the personnel to give the best of their services. With the decoupling of the normal OPD from the emergency department, we know that the service delivery at this place will improve and become better than before. The second item for you to look at, Mr. President, during the commissioning is the police virtual medical center, which has been set up for the purpose of ensuring that police people across the country can access health care from the comfort of their homes, the comfort of their offices, the comfort of their duty point, and the comfort of their villages and towns and cities that they work without necessarily showing up at the police hospital. We know that this project, if it is carried on to the letter, it will help us a lot and make the access to medical care for our personnel very easy and accommodating. The third one, Mr. President, is to do with the launch of Police Emergency Medical Intervention Fund for providing financing for personnel who sustain injuries or develop one medical condition or the other in the course of performing their duties. And Mr. President, for us to see the significance of this very project, I would like to present to you the first beneficiaries of this fund. And I would like to start with Chief Inspector Victor Mark Anako, who for almost 15 years has been waiting for this opportunity in order to have an artificial leg. He was in an operation in Sawam. They were called to respond to a crime scene, a robbery crime scene, a bank robbery crime scene at Sawam, and he was shot by armed robbers in 2007. And Mr. President, the resources to take him out during those years weren't forthcoming. And this gentleman resigned to his fate and never showed up, and he was fully or virtually forgotten until today that he's being presented. You will be presenting to him the full cost of his medication in Germany.
Well, here's a thorny issue. My credit finishes too early. That has become a mantra among many mobile phone users in Ghana. Have you been experiencing faster mobile credit depletion soon after recharging? Perhaps it's about time you started checking the number of mobile service subscriptions on your phone. A Love News investigation has found that as high as 95 services are unknowingly being subscribed to by mobile phone users. There's more in this report.
100 affected users were therefore selected for this exercise. The survey found 95 unknowingly subscribed services. Out of these services, Games24 Pro, Jobs.go Plus, M-Scorer, RD Sexy Pink, a music app constituted the frequently occurring services from 6 and above. RD Sexy Pink and Jobs.go Plus were found among 12 users. Games 24 Pro and Music app on 12 and 13 users respectively. M-Scorer took the first place, being found with 20 users. Our survey found the subscription charges range from 19 pesos to 85 pesos. One of the subscriptions which appeared in 35% of the affected users was M-Scorer. This service carries a hefty price tag of 75 Ghana pesos. Just when we thought we were done, we chanced on another service known as Premium Trivia. Premium Trivia topped with 85 pesos. According to the CEO of the Chamber of Telecommunications, Dr. Kenneth Ashibe, many of these unsolicited subscriptions are being perpetuated by the National Communications Authority licensed third parties.
Third parties who have been given licenses by the NTA, and some of them, true, they don't go by, the processes. So I know what the networks are trying to do is to make sure that for every subscription that you do, you are giving the option to sign in, So all of those are kind of policies that we're trying to get enforced.
Dr. Kester Quest Afechi of the Ghana Telecom University, who has no idea of how he subscribed to one of his 4 subscriptions, believes mobile users subscribe to these services unknowingly. He said these requests to subscribe appear at the end of calls and sometimes text messages.
Okay, so normally when people make calls, then they realize that there is a pop-up that comes. So they click on these pop-ups without knowing that these pop-ups will lead them to subscribe to things that they have not intended to subscribe to. And some of these things ended up deducting money from their account. So they also receive text messages sometimes, and then these things pop up as well, and then they click on it. So most of the subscribers of the telecommunication network don't actually subscribe to them as regularly as other subscription services are. So for example, if you want people to subscribe to a particular service, you have to first advertise the service, and then they will have to use a short code to get access to that service. So they enter the short code and follow the prompts, and then they can now subscribe to the service that you want them to subscribe to. But what is going on these days is that, as I said, immediately you finish the call, the pop-ups comes, and sometimes there is no message attached to the pop-ups. It's just a message that comes with an OK. You click on the OK, leads you to another one. Some don't even lead you to anyone. Before you realize, you subscribe to some of these services. So that is what subscribers are going through these days. Yeah, for the telco services, what they have to do is to monitor their network and then be sure that the people that they give access to for certain services don't abuse it by using these things to extort money from their subscribers. Because if monies are getting deducted from the subscribers' accounts and they realize that if they use this telecommunication network, their credits run down, they will end up using other services, because the subscribers are going through a lot when it also comes to this mobile money services, the scammers, and all those kind of issues when it comes to the WhatsApp they use and other services they use with their mobile phone. So when this one adds up to it, it creates a burden, and they feel that the network is not secure again. So they will better go to network providers that provide them more secure communication and also ensure that their subscribers are well protected. So one of the things also that the telecommunication services can do is to send messages regularly at the end of the month to alert subscribers in terms of some of the subscriptions that they have, so that when they go through the list and they realize they've not subscribed to a particular service, they can remove that. And they have to make the process of the removal also very easy and simple for the subscribers, so that they will not go through the headache trying to find out how can I get off this or whatever.
In the meantime, Dr. Quest Afechi also advises mobile phone users against clicking on pop-up messages. He says mobile phone users can simply click on the power button. Reporter for JoyNews, Kwesi Deborah.
Well, the Methodist Church is hoping not only to win souls for Christ, but also harness development in the Nkonya traditional area in the Biakoya district of the Oti region. The church has therefore commissioned a borehole to indicate its commitment to achieving these objectives after dedicating a chapel in Nkonya and Tumda in the Oti region. There is more in this report.
The borehole facility is expected to end the perennial water drought in the Nkonya area. It would also contribute to curbing the outbreak of communicable diseases and ensure good health among residents. The presiding bishop of the Methodist Church, Ghana, the Most Reverend Dr. Paul Kwabena Boafo, explained the church's development agenda for the Nkonya area.
We believe that by giving them water, potable water, we have taken away a lot of the waterborne diseases that would have affected the people. Very soon, the unit that deals with education will come and also survey the area and look at where we can start with schools. Then we'll come with either a clinic or a health center. That is how we do, and that is how we strategize. So the surveys are done, then we'll sit down, look at where to locate schools, where to locate health facilities and other things.
The Tema Diocesan lay chairman, Brother Alfred Sachi, detailed his plans to establish an entrepreneurial fund to help enroll members in skill training programs and provide them with startup capitals.
No, education is our greatest challenge because if people are well educated, there's nothing they cannot do. So my view is that as Christians, we need to identify people that we can also help, through education, for them to also become men and women of substance. So my view is that if we are able to rally our resources, bring our resources together, no single person can do it all. But when we are able to solicit for others to share in our visions and ideas, then we can make inroads in some of the uncharted areas. Because you see a lot of young people out there, some just need some basic vocational skills. Some also need some little capital injection. So one of the passions I have is to be able to help build an entrepreneurship fund in our church so that the young people that are entrepreneurs and need some capital injection will be supported in that area. And it's a project that we are currently working on.
The Biakoya District Chief Executive, Millicent Kabo, lauded the church on its role in partnering government to develop the country. She appealed to the top hierarchy of the Methodist Church Ghana to consider establishing a tertiary institution in the area. The 100-seater chapel, a Sunday school shed and sanitary facilities project took 8 months to complete. The lay chairman of the Tema Diocese, Brother Alfred Sechi, and his wife, Mrs. Janet Sechi, sponsored the project with 350,000 Ghana cedis. Fred Kwame Asari, JoyNews, Nkonya, Tumda.
And on that note, we wrap the AM News. But do stay, we have a lot more action as we host Dr. Asa Asante in our news review. Do stay.